All right, welcome. We are about to dive deep into trauma, dissociation, and anxiety. And I want you to forget the textbook for a minute. In the next few minutes, we're going to sketch out exactly what you need to know for your exams and, even more importantly, for safe clinical practice. Let's get started. So here's our roadmap. First, we're going to sketch out the why, the brain's core defense systems. Then we'll jump into assessment, zooming in on those critical cues you absolutely have to recognize. After that, it's into the communication lab to script out what to say and what not to say. And then we'll highlight the big pharmacology red flags before we put it all together in a final clinical decision point. Okay, so first up, let's really draw out the why. You see, to truly get a handle on the behaviors you're going to see in practice, we have to understand the brain's defense systems. And we use two core analogies that are really going to make these complex ideas just click. Okay, let's map out our first analogy. I want you to think of anxiety as a car's security system. So picture a car driving safely. That's kind of like mild anxiety. You know, it's that useful system that makes you check your mirrors. Now, picture that same car, but its alarm is just blaring, lights flashing. That's severe anxiety. It's a system overload that makes it impossible to think straight. And then for panic, we've got the engine smoking and shutting down completely right in the middle of the highway. See, it's not a flaw in the person. It's a defense system that has gone completely haywire.
And now for our second big analogy. Imagine an electrical circuit breaker in a house. When the system gets hit with this massive, overwhelming power surge, and that surge is the trauma, the brain does the only thing it can possibly do to stop a total system meltdown. It flips a breaker. And that is dissociation. It is not a choice. It's a hardwired, protective mechanism that literally shuts off conscious awareness to save the whole system. The lights just go out in one part of the house to keep the whole house from burning down.
All right, so we've moved from the why, and now we're getting into the what. We're going to focus on the critical cues you have to recognize for assessment. I'm telling you, getting these differentiators right is absolutely fundamental. Let's really sketch this one out, because this timeline is so critical. On one end, you've got the traumatic event. Now let's mark off some key points. From the moment of that event all the way up to the 1-month mark, we are in the zone of acute stress disorder, or ASD. So if a patient's symptoms, the flashbacks, the avoidance, are at the 3-week point, it's ASD. But the second we cross that 1-month threshold, our diagnosis has to change to PTSD. This is a classic exam question.
Okay, here's another critical distinction you have to know. And to keep them straight, it's easy. Just break down the words themselves. Depersonalization is a detachment from your person. It's that out-of-body experience. Derealization is a detachment from reality. The world feels unreal or distorted. It's that simple. One is internal, the other is external.
All right, now we're going to pivot to the how, what you say, and just as important, what you must never say to a client in distress. This is where clinical practice really meets the real world. This is the wrong way. This question, tell me exactly what happened. It's not therapeutic at all. It's basically an interrogation that forces the client to relive their trauma. This strips them of all control and can cause severe re-traumatization, or push them right back into that circuit breaker state of dissociation. So what's the therapeutic way? Well, the absolute #1 priority is safety. So instead of digging into the trauma, we have to ground the client in the present. And we do this by engaging their senses. A simple statement like, "Can you tell me 5 things you see in this room right now?" That forces the brain to reconnect to the here and now. You absolutely must reestablish safety before any trauma processing can even begin. And now, let's move to pharmacology, where our safety-first approach absolutely continues. We're going to map out the red flag warnings for these key medications. I want you to imagine we're sketching a big red flag icon next to each of these critical points. Okay, this is a critical distinction. These two drugs are not interchangeable at all. Let's use a visual to make it stick. Benzodiazepines, like alprazolam, they're the fire extinguisher. Use it for an acute emergency, like a panic attack. It works super fast, but it comes with high risks, like dependence. Now, buspirone, that's the sprinkler system. It's for long-term chronic anxiety. You would never use it for an emergency because it takes several weeks to kick in, but it's much safer for maintenance. Let's really hammer these red flags home. First, a skull and crossbones for benzodiazepine withdrawal, because it can cause lethal seizures. Second, a big no symbol for giving buspirone in a panic attack. It's completely useless. And finally, a big shield icon for SSRIs. They are the first-line protective treatment for pretty much all of these disorders.
Okay, it's time for our NGN clinical decision point. Let's put everything we've mapped out together. You're going to see a clinical vignette. The question is, what do you do first?
Read this question carefully. Just like with all clinical vignettes, I want you to zero in on the single most critical piece of data presented. Everything you need to know is right there.
And there's our answer. The absolute key cue in that whole vignette was the timeline, 2 weeks. And as we sketched out earlier, that falls squarely within the window for acute stress disorder. You simply cannot diagnose PTSD until those symptoms have persisted for longer than 1 month. This shows exactly why knowing those timelines is so essential for the right diagnosis and the right intervention. Now, thinking clinically, what other critical cues would you be assessing for in this client? That's your next step.